According to the Human Rights Commission, healthcare services are largely under-resourced. Registered misgivings range from shortage of personnel, availability of medication, to long queues, impacting on the ability to deliver adequate care to patients, particularly those in rural areas. A health expert from the Northwest University says the current approach at public clinics needs to be changed.
The approach that is being used in the clinics in Northwest currently is what we call a supermarket approach. More of everybody comes and we treat everybody everywhere with the symptoms that we have. It's a generalist approach. It's not really helpful because that's where it creates lots of gaps. For a youth, you need full youth services that are really dedicated to you. You need fully dedicated services that are dedicated to women.
Dr. Machailo says this often leads to late diagnosis.
If you look at cancer, for instance, it's not something that will develop now and be treated now. It must have developed over time. The problem with cancer is that when it starts, it doesn't have symptoms. So the symptoms are not so obvious. So that's why it's important for all of them every woman to at least go for screening and understand where the screening services are. Currently, when you go to the clinics, they look into what symptoms do you have and then we treat the symptoms. But there's no basic screening facilities. That's where I can go. It's Women's Month. Those pap smear services should be available almost in every healthcare facility.
According to the Cancer Association of South Africa, breast and cervical cancer are the top 2 diagnosed cancers among women. Some women in the province are cognizant of the importance of screenings.
I know the importance of doing services like pap smear, and I make sure that at least once a year I do pap smear, so I get the result on time. I didn't get any challenge since then. And other services like HIV testing, STIs, I do.
I am happy that they are helping us here at the clinic. I did pap smear in June last year and got the results.
It's very important to do tests as women so that we know about our health. I went to the clinic to do a mammogram to check if I have breast cancer, and I also did a pap smear in April.
Others, however, are asking for clinics to run 24-hour operations to provide adequate health care.
If they can help us by Midwife Re Services at our clinics, we are not able to give birth there, but have to travel as far as the provincial hospital. Most of us do not have money to go there.
We'd be happy if there can be night shifts. It becomes a problem if we are unable to go to the clinic at night. We have to travel. I wish my local clinic can work for 24 hours a day, even on weekends. That way we don't have to travel far in case of emergency.
Meanwhile, Dr. Machailo has advised against self-diagnosis, which she says is often influenced by inadequate health care at different clinics.
It's also advisable for the people and the public to at least go out there, go to the clinic, seek information, ask more questions. Lack of information is what is leading people to try and get information for myself, and that's why we end up in Google. If my heart beats like this, it means I must go check what can be the problem. But then if you go onto Google, Google may give you something that is not even related to what is actually happening within you, because you're only going to get to look for those palpitations that you get, but you don't look into what other symptoms are there.
Dr. Machailo encourages the use of toll-free call centers, which she argues will improve access to health care. Deborah Pakedi, SABC News, Mahigeng.